here to speak to you because I'm a rare disease patient. And I have a story that I want to share a little bit with you, not the whole thing because we'd be here all night. And I want to talk to you a little bit about what I think is one of the ways in which rare disease patients have a way forward that we're not really quite paying enough attention to yet. And I want to talk to you about it today because I think it's an important thing for those of you who are to-be doctors to be thinking about as well. So let me start with, I was sick my whole life. What does it mean? How sick was I? Well, these are the symptoms that I grappled with from the day I was born. A full body rash that would come and go with no triggers, headaches, bloodshot eyes, arthritis, migraines. There was all sorts of different things that were wrong with me that I couldn't figure out, and neither could my doctor. So I went to my family doctor, my GP, between the ages of 1 and 18. I have over 180 separate entries in my medical records. And then when I turned 18, I went off to university and never came back to that doctor. But also, I gave up. And over those years, I'd learned how to basically treat what I was dealing with, my symptoms at the time as they arose. And so I would take anti-inflammatories, right? I would take painkillers, and I probably should have bought stock and Visine or whatever, P&G, because I would have eye drops with me at all times, no matter where I went. Because I had a full body rash, I would never wear shorts or short sleeves. I always had a hat on, and I was that guy wearing his sunglasses at night because I didn't want people to see my eyes, right? So I'd wear my hat and my glasses to class, and I would just kind of, you make do, right? You live the life you have to live. So this is a picture of 18 pages of my much more voluminous medical records. They're blurred so you can't follow along, but this is just this type of record. There's another, I'd say, 15 pages, and then there's, on top of those 180 visits, there are visits to the ER, there are specialist referrals. So my actual records, when I went back and got them, were about 84 pages long. And that doesn't include the things that didn't make it into my records, right? Like walk-in clinics, or when I was not there and I was away at school or away doing something else and I went into a different physician's office or to the emergency room. So this is the start of the story, right? Throughout my whole life, just like we heard, I went from specialist to specialist, having test run after test after test after test, and the answer was always, we don't know. I never had an answer to the question of what was wrong with me. And so I gave up and I just lived my life. But all of that changed when I was 31 years old, because when I was 31, my wife and I had our first little girl. And she came out with a rash on her body. And babies have rashes, that's a thing. And so everyone around me was, don't worry. But me, I knew that I'd had that my whole life and never been able to figure it out. And I knew that that was my rash. And so like many rare disease patients or people in this community, I finally got the motivation to start taking matters into my own hands. When I was growing up, you couldn't go online and look up a physician and find out what types of things they were good at and what results they had, and their patients hadn't said, I went to this doctor for this reason, and great. So now I could do that, right? Like now I was a grown-up, I knew how the internet worked. I got on there and I made a list of all the things I was curious about, and I went back to a new family doctor, not the old one, and I said, here's what I want. I want a referral to this person and this person and this person. And so I took those referrals and I went back. Now I'm motivated. My daughter's got this thing. I got to figure it out. It's not good enough for me to just live anymore. And so I got tests, and every test came back the same. We have no idea. But I got the same test here as I got there with the new physician looking at it, trying to figure it out, right? So what did I do? Well, I did what any patient does, and any doctor tells you probably not to do, is I went on and I consulted Dr. Google. I was all over the internet. And what did I find out? Well, not much. But then I consulted Dr. Google Images. And so after scrolling through, I'd say thousands of images, I stumbled upon a picture of someone's skin that looked like my skin. Cool. So I clicked it, and I followed the path, and I landed on a blog post from a man in Germany. And it was written in German. So Google Translate came in handy at this point. And then I went back to the medical journals and I started doing research. Now, I think that's something that not a lot of patients have the capacity or the chupsa to kind of do. But I was at that point really desperate, and I had a law degree and I had an advanced education, and I thought, I can do this. And so I went back and I started reading medical journals, and I came up with this idea, and I looked back at everything I'd gone through, and so I got a referral to sick kids. And my daughter and I went to sick kids. She got tested, and that's when, at the age of 32, and she won, we were diagnosed with a 1 in a million rare disease called Muckle-Wells syndrome. And that changes everything. So the first thing I did was I said, you know what, there's not enough information out there for people like me. I'm going to make a website, and on this website I'm going to put stuff. And so I went and I made a Facebook group. I met people within this community, and I said I want to put more images on the web. And so I've got it buried in here somewhere, because I don't want to shock you with all the images. Buried in here somewhere is pictures of what it looks like to have Muckle-Wells syndrome. And I thought, well, maybe I can train Dr. Google to be a little bit quicker at recognizing, so people can find this skin symptom a little bit quicker. And so we created this. And then I realized after doing this that I need to learn more. All I know is about my specific disease and kind of the family that it's in. CAPS is cryopyrin-associated periodic syndromes, which is the family of diseases that Muckle-Wells is in. And so I went and I got involved with the Canadian Organization for Rare Disorders, and I CORD. And that's when I really started meeting people within the community and learning that my story isn't all that uncommon. A lot of the things I've gone through are actually quite common. And so I learned a lot, and I put all this up here so you can come back to it later, but a few things I want to point out is that a lot of people are misdiagnosed with rare diseases, and they're constantly misdiagnosed. A lot of people are just like me, and they give up. And then the system doesn't know they exist, right? No one's tracking them anymore. They give up and they go about their lives. A lot of people don't have access to care, don't have access to effective therapies, don't have access to clinical trials. And so there's just this massive gap that these people fall into, and then they just fall out of the system. And I learned that my story wasn't all that uncommon. So for me, I tried to think about why that might be. And I think that we have a healthcare system in this country that's set up to, in some ways, make this harder for us. So rare disease patients, for me, I was diagnosed, my doctor thought we were number 11 and 12 in the country, right? So maybe there's 2 of us in Ontario, 5 of us in BC, blah, blah, spread out across the country. Our healthcare system is structured so that healthcare is delivered by the provinces and territories, right? So they're responsible for the actual delivery of healthcare. At the federal level, they make some rules about what kind of things you have to deliver to get your transfer payments. And at the provincial level, you need those transfer payments to deliver the kind of services you're supposed to deliver. But what there really isn't is any kind of mandate to work together. So if you're a rare disease patient in one province, you're getting totally different care than a rare disease patient in another province, potentially. And that can be devastating for rare disease, people in the rare disease space. But there is no real quick fix, right? There's no quick fix around the Constitution. It is what it is. But what we've kind of come up with is we've started recognizing that we need some more kind of pan-Canadian approaches to healthcare. And so there are a few out there that are federally funded pan-Canadian approaches to healthcare. Now, they aren't specific to rare disease. There's 8 or 9 different federally funded pan-Canadian healthcare organizations. And there's a couple of new things emerging, mostly informally and because of creativity and ingenuity on the part of the ministers and the first ministers. So something like this, negotiating pharmaceutical prices, that's a new thing that we're trying to do, but it's not mandated that we do it. It's the provinces and territories getting together and saying we got to save money somehow, right? So I think that there are limitations that patients like me come up against, and we have to try to be a little bit more creative as to how we go about trying to get around those limitations in order to reach our goals. We have to be thinking about innovative things. And so this is a report from last year, and one of the things it says in it is that the federal government needs to do a better job of organizing and managing data and governing data and making it so that we have an electronic health system at the federal level. And so this is kind of where I want to take today's talk. I want to talk to you about what I think is an untapped opportunity for rare disease patients, but not because it's been there for a long time, but just because it's emerging, when we start thinking about emerging technologies. I'm not going to talk about gene editing. I'm not going to touch that with a 10-foot pole. But I want to talk to you today about machine learning and artificial intelligence and big data. So why do I think that's a topic that's worth addressing? Well, we know that computer scientists right now are deep into designing tools, algorithms that can help us understand large data sets. The federal government is all in on funding innovation in this sector, and we're seeing real success. There's a lot of publications coming out, mostly in the research setting, where a clinician has met a patient population, they can't figure out what's going on, they have a lot of data, they call in one of the computer scientists who's also appointed to the research institute, and they say, help me figure this out. And so we're seeing a lot of success, especially in the rare disease space, right? So I don't know if it was mentioned earlier, but rare diseases, we think about 80% of them are genetic. And what is a sequenced genome if not pure data, right? Especially if you don't know what you're looking for. So there's ways in which AI can help us identify disease quicker. It can help us generate new novel therapies or different approaches to treating diseases. It can save the system a lot of money. For example, if you're tracking how people come in and out of the hospital, you can maybe identify trends that will help you either refer or bring them inpatient or not send them home so quickly and send them to see someone else, et cetera. Lots of different ways in which this can work. And I think this is what's going to really drive personalized medicine as we move forward. So let me give you an example. This is my health records, right? Come back to it now. A really good specialist, if I had gone to see them, and they knew about autoinflammatory disorders, they could have picked up on this. But a regular GP who sees families for the last 40 years, they're not going to know 7,000 plus rare diseases. They're not going to pick up on this stuff. So there's 180 entries of just individual visits. But my disease has been known since the 80s. Like, it's been identified, they've understood what the actual manifestations of it are. The clinical diagnostics have been written down, how to actually diagnose it. If you had programmed an algorithm with my symptoms, it would have picked me up by visit 6. So I don't say that lightly. I think that's a pretty important thing to do, to understand. Now, if I was going through the system, I would be in an electronic health record. And those visits would all be digital. And if I consented to it, that information could be used by researchers. It could be used by computer scientists. They can create an algorithm. If any of you have ever heard of phenotypes, it's out there now. It's a predictive tool that clinicians use when they understand the phenotypic manifestations of a disease, and it can help them match it up. Phenotypes picks me up real quick, and it can diagnose me. This is happening quickly. And we're starting to integrate a lot more of these clinical decision support tools into the electronic health system, electronic health records. I imagine now what's going to be happening, if we have enough data on specific rare diseases, is that when someone like me walks in, the machine will say, and a little notification will pop up, and it will say, this patient has symptoms A, B, and C. Those are generally associated with autoinflammatory diseases. You may wish to ask about D and E. The combination of those things usually signifies Muckle Wells as a diagnosis. Click here to learn more. That's easy programming now if we understand the disease. So I think what's going to happen now in the healthcare space, I think it's quite obvious, but also in the rare disease space, and I think it's a big opportunity, is that data generation with a purpose is going to really drive our healthcare system forward. Healthcare is chock full of a ton of data, but it's not there with this kind of purpose, and it's actually siloed depending on who's generated it and what they're using it for and what research they're doing with it. But I think that's going to be changing. I don't want to take that lightly, though, because I think there's a lot of questions we have to ask before we do this. We have to figure out what data, why, who gets to collect it, who gets to keep it, who gets to use it, how we can use it to support clinical decision-making. There's a lot of really important questions. But I think that the way the rare disease community works, first of all, we're motivated, we're well organized, generally speaking, and I think a lot of people, like me, are desperate for an answer. And so we're reliably present. A lot of people with rare diseases give up their jobs to become advocates full-time. If you look up my story, that's one of the things I did too. Sold my house and gave up my job so that I could take on more of an advocacy role and pivot my career to do this more regularly and more full-time. So I think what you find is you find a lot of people who are very motivated to be a part of this conversation. And I think there's an opportunity right now for rare disease patients to insert themselves into this discussion as we create and generate these systems and move them forward, so that we can be at the forefront of this dialogue and setting the agenda on AI in medicine. And I think this is very important for a few reasons. First, because I think it's an amazing opportunity. And I think that in the rare disease space, we've been trying to get into the policy discussions for a long time. And it seems to me that those discussions aren't very fruitful right now. I have a piece on the website, The Conversation, today that explains why I don't think the rare disease patients are invited to the table in quite the legitimate way they should be. But I think we can get ourselves to that table because rare diseases are compelling research subjects. We generate a lot of genomic data, and if we start keeping track of all the other things, the physical manifestations and our experiences with our disease, then there's even more data to compel computer scientists to start looking at our diseases. The last thing I would like to say is that I think that if this community, and you in the room who are supporting this community, don't do that, we're going to be left behind when the system transforms, and we're just going to be screaming in the dark, trying to get someone's attention like we have been for so long in the policy space. So thank you for your time.